One of the problems we have in the setting of Moyamoya is that there's not enough blood supply to the brain. As these big blood vessels in the front, the carotids, the middle cerebrals, the anterior cerebrals, progressively narrow over time, even though the brain tries to compensate by opening up these tiny collateral vessels, really you're fighting against a rising tide, and ultimately the brain is going to be deprived of oxygen. And in the short term, you can have transient spells where the brain doesn't have enough oxygen, these transient ischemic attacks. And in the long term, these can progress to full strokes where parts of the brain actually die because they don't get enough blood supply. What we have to do as physicians is to try to figure out ways to keep the brain healthy and provide blood so that the brain doesn't get strokes. In the short term, we can try to do this by making sure the blood supply is optimized as best as possible. So we will give aspirin to thin the blood a little bit to help it squeak through these tiny pathways. We'll also give intravenous fluids or make sure the child's hydrated to make sure there's water pressure to keep water flowing through the pipes to keep blood getting through the blood vessels. Ultimately, though, if this is not treated surgically, the end result is that you'll have continued multiple strokes with either severe cognitive decline or, in many cases, death. What we try to do to treat Moyamoya is a surgery, and the goal of surgery is to bring new blood supply in from healthy blood vessels to supplement what's being lost from the unhealthy carotids, middle cerebrals, anterior cerebrals. The surgery that was pioneered and developed here at Children's Hospital by Dr. Michael Scott, and is one that both he and myself do currently here now, is a technique called Pial Synangiosis. What this means is we take a healthy blood vessel from the scalp, and there are many, many blood vessels, so they're redundant, and we use that healthy pipe to bring new blood supply to the brain to supplant what's not being brought in through the carotids. And the analogy I would use for this is if you're in the second floor and you're trying to fill your tub with water and the pipes inside the walls aren't working, you can run a garden hose up from outside, bring it in through the window, and you get a better supply. The way that we do this surgery is to try to isolate the blood vessel from the scalp. We make a tiny opening in the skull itself, and that allows the blood vessel to be put in contact with the brain. We then open the lining over the surface of the brain and then actually stitch the blood vessel to the brain itself. What happens subsequently is that the contact of the blood vessel with the surface of the brain, in addition to all the growth factors and the essentially fertilizer that is produced by the brain that's starved for oxygen, causes this blood vessel and the surrounding tissues to grow a whole bunch of new healthy vessels that can bring in new blood supply. And again, to use the idea of a driving analogy, here in Boston, if the main route to Boston, Route 93, is clogged up, you can take an alternative Route 128 outside the city to get the blood where it needs to go. And what we're doing with Pial Synangiosis is to say, well, if the carotids are not healthy and not able to be fixed, we then use an alternative route to bring the blood where it needs to go. The last thing I might mention is that people ask sometimes, well, can you just reopen the blood vessel that's narrowed? We can't really do that, and people have tried, in part because the narrowing is not just in one tiny spot, but usually covers a long stretch of vessel which is diseased. And therefore, even if you try to open one or two areas that are narrowed, ultimately they will continue to close down and close off. And so what you really need to do is to provide an alternative means for which blood to get where it needs to go. And that's what we do here with Pial Synangiosis.